Welcome back, everyone, to the Sedation series. I am Charlotte Marquis. I'm a board-certified veterinary anesthesiologist, and today I will be talking to you about sedation for animals that need laceration repair. So there are many different types of animals that come into our hospital that need whatever type of wound care, and these come from a variety of different incidents. It could have been a hit by car injury, could have been a dog fight, could have been a wound that we really have no idea how they got it. And depending on the severity, the involvement, and the animal's general condition, that is going to change your plan for sedation and anesthesia. So I want to talk about a couple different considerations for animals that need lac repair, some of the equipment you'll need, and some of the things you need to consider, and then a couple of different drug protocols we can consider for these animals. Now, with those things being said, every patient is going to be different, and dynamic assessment is one of the most important things you can do for your patient. So by no means is this an all-inclusive list, but hopefully this should help get you started and be able to do most of these things safely and preparedly. So let's kind of start from the top. So when we have an animal come into the hospital that needs wound care, what are the things we need to know before we get the animal sedated or before we start? So I like to always start with the basics: a physical exam, history, and information about the wound. So it's important to know the animal's general condition, if they're on any medications, because maybe those medications are going to affect the animal's blood pressure or maybe like their volume or their hydration status. We need to know about how long this has been going on and the involvement, the severity. So if it's something very small, maybe it's going to take a short amount of time and that changes your plan. If this is something that's going to take over an hour, that's going to be a different consideration. So you'll need things like more drugs, more equipment, more time, etc. Kind of with overall condition, something like stability, you need to know how healthy this animal is and have a look at them. You can't just bring them from wherever they are and start the procedure. You need to be able to optimize their condition, because everyone can sedate an animal, but not everyone can wake them back up, and that's why the owner's bringing the pet here, right? Where you're going to do the procedure and the anticipated surgical time is very important. So are you going to be doing this on a wet table? Can you provide active heat support? Are you going to be doing this in the ICU? That's going to be different, especially if it's busy or they're doing something like CPR or there's lots of patients. So think about your space and think about how you can intelligently prepare that area so that it's easy to work around and going to be supportive of your patient. In anticipated surgical time, if it takes less than like 45 minutes an hour, that's one thing. But if it's longer than that, we don't have a lot of drugs that work longer than that period of time, and maybe we need to either redose or consider general anesthesia at that point. That's also a great point to think about things like injectable antibiotics or heat support, because usually the longer you go, maybe the animal's going to get cold and needs your help there. Or, if this is a surgery and it's an open wound, then chances are your animal will need injectable antibiotics. So think about that and ask about that before you get started. So a couple pieces of equipment you'll need to get ready. So other than having the patient and other than having drugs for your sedation, you're going to need some other things to make sure that you're going to be safe and successful. So things to prepare the wound. So that makes a lot of sense, right? Laceration repair pack, clippers, scrub, flush. So these are all things that we need just to get the wound ready, maybe before the doctor even has a proper look at it. Things like sterile lubricant and antibiotics are helpful, especially if the wound is deep or it's very involved. So asking the doctor which antibiotic they prefer or if they need one at all can be important. And if it's something where there's like puncture wounds or there could be hair contamination, getting sterile lubricant into the wound will prevent things from hopefully kind of getting inside there further. Other things you might need for this, so bandage material, suture material, anesthesia machine and monitor. So if your animal has a large open wound, we're going to need to probably cover that at some point, either with a tie-over bandage, a splinter and cast, or some other things like drains. So having some of that out, like a selection or a buffet of wound care equipment, would be nice because that way you don't have to leave your patient during the procedure. Suture material, this is going to depend, of course, on what we're doing and what the doctor prefers. Anesthetic monitoring equipment and things like that, lots of drugs can affect the way that an animal moves air. Sometimes these wounds are over different parts of the body that might affect their breathing, either the character or the efficiency of the breathing. So we do need to think about that. And if we're giving drugs which are going to change the heart rate, the blood pressure, the breathing, we need to have ways we can support the animal. Other things you might require, so things like active heat support and IV fluids. So there are certain sedatives which makes animals diurese or produce more urine, so we need to think about that. We also know that sometimes, especially if animals are hurting, in pain, maybe they've had this wound for a while, maybe they're dehydrated, haven't been eating as well. A lot of these medications we use can also make them vomit, so being able to support them with IV fluids is really important, especially in those scenarios, or if there's things like active bleeding or oozing. Active heat support, so hypothermia is the number one cause of a prolonged anesthetic recovery, and especially if you're doing something with flush or on a wet table, it's just so easy for an animal to get cold. So cover your bases and just make sure that you have a way to support them. Other things you might require, which we don't always think about, so a camera and then radiology requests and blood work. So the last two kind of go along with checking your bases right. You need to know about the animal's general condition and their health before you get started. And a camera is nice because if you're taking pictures of the wounds, either for the record or for the owners, it's nice to kind of see how those things go over time. Plus, if you need help, like if you need to send them to a surgeon to have a look at, that's a really great option because you have it in the moment. Last couple things there. So drugs kind of goes without saying. If you're going to sedate or anesthetize a dog or cat for lac repair, you're going to need drugs. So you might not just need one dose. If it's going to be longer than 45 minutes, you might need a second dose. So planning to bring 50 to 100% more drugs than you anticipate needing is usually a clever idea. And an IV catheter is extremely helpful, although not necessarily mandatory in these cases. So my general rule is that if the animal is a CPR code status, like yes, they want CPR, it needs to have an IV catheter because it's going to be the easiest way to start CPR. You kind of don't want to be caught red-handed, so to speak. So protect yourself, protect your patient, make it easier if the procedure is longer and you need more drugs. Place an IV catheter. So when we think about lac repair, there are a couple of things we need to consider that might make us go, okay, it's time for me to reevaluate and rethink. So lots of animals have simple wounds, we evaluate them, we sedate them, clean them up, and they do just fine. But there are a couple wounds that you might be preparing for the doctor after you've sedated the animal that I want you to look at critically and say, okay, I need to tag someone in here. And here are a couple examples of scenarios where you should ask a doctor or talk to someone about more stabilization for that pet. So if there's active bleeding, so that makes a lot of sense, right? So if you have ready active bleeding, this is an emergency, so that needs to be stopped. We can do things like pressure with gauze or lap pads, we can use tourniquets, and then we can use vessel ligation if we need to get there. But recognition is key here. So when you have kind of slow, oozing, dark blood, usually that is a venous bleed. And if you have something that is bright red, it is pulsatile and shooting out, that's arterial bleeding. Both can be detrimental. We want the blood to stay inside the blood vessels. So if you see active bleeding, please let someone know and then at least apply some pressure or maybe a tourniquet in that area until an emergency intervention can be planned. That's another good reason to have things like an IV catheter and fluids. You might need to replace that blood. Air movement. So you're probably wondering, what is that? So if you have an animal where air is leaking out of the wound, especially around the face, the neck, or the chest wall, that's a possibility that there's some type of air puncture. So the trachea could be torn, there could be an open pneumothorax or a lung injury. So if you see air movement out of a wound or puffing or it feels like bubble wrap, stop and let someone know. Because if air is leaking out of the animal, it's not staying inside the animal and helping get oxygen to tissues where it needs to go. So air movement or bubble wrap feeling, stop, let someone know. Internal organs. You could probably guess why this is a bad thing to see. So occasionally when we have wounds that are either over the chest or over the belly. We can see things like muscle. Sometimes we can see organ tissues. If you ever see that, please let someone know, because in that case, we might need to convert to general anesthesia if the animal's just sedated, or we will need to consult a surgeon to provide further care. So that would be very important to find out. A puncture wound over the chest or abdomen. So this kind of goes along with things like seeing internal organs. So even if the wound seems superficial, kind of small, if you have anything that's over the chest, anything that's over the belly, always assume that it is full thickness and it is inside of that space. In that case, try not to do a lot of deep probing or cleaning. Alert your doctor, ask them to have a look, maybe see if the surgeon can have a look as well. You would probably much rather have the doctor find that out than you find that out accidentally and then we've caused some type of damage or the animal becomes more unstable. So just let them kind of take the reins on that, and that will protect both you and your patient. Something like flail chest. So this is a condition where usually there are multiple ribs broken in one area. And what happens is that instead of the rib cage kind of moving out and in together during normal breathing, the flail chest dog or cat will have a little segment that moves on its own. And this can be a sign that the chest wall is broken, or that there's air movement, or that the animal no longer has an intact chest wall. And this is a problem for several reasons. So, with a lot of our sedative drugs, we can have effects on breathing, we can have effects on the heart rate and the blood pressure. And we know that breathing, heart rate, blood pressure are all things that are important from the standpoint of the chest. So if we have a chest injury, there is always the assumption that something could happen there, right? So if you see that, please let someone know and try not to do a lot of deep probing of that area. So now we've talked about the things we need to know and the equipment we need to have and the things we need to kind of stop and reevaluate. Let's talk about a couple different drug combinations that would be acceptable for several different types of patients. Now, like I said earlier, it's not going to be appropriate for all. This is going to be very case by case, but these are just a couple things that I use on the clinic floor to help me get these things done. So if you have a friendly, cooperative animal and you need deep sedation for laceration repair, generally speaking, placing an IV catheter and giving an alpha-2 and an opioid is going to be a great idea. So mid to high range doses of opioids can be helpful in sparing some of your more cardiac acting sedative drugs, such as things like ispromazine or dexmedetomidine. And like I said, bringing 50 to 100% more can be really helpful, especially if the procedure is longer. So IV alpha-2 with opioid. If the animal is not cooperative but they are healthy, then giving drugs IM and then placing a catheter can be very helpful. So if your animal is uncooperative, you also might need to consider increasing the dose by 50 to 100%, just depending on how they are acting. Other options, so we can always try something like a combination. We can try an alpha-2, an opioid, and an anesthetic agent. So this would be something like dexmedetomidine, methadone, and either ketamine or alfaxalone. So this is a great combination when you want to provide a little more immobility, because remember, sedation does not guarantee immobility, only anesthetics do. So anesthetics are things like alfaxalone and ketamine and propofol, which you don't give IM, and things like inhalants, so ISO, SIBO, etc. So if you need an animal to be immobile or you have a vicious animal, then I would include a sedative injectable in your protocol. If your animal's cooperative, you're not going to need that. Other things you can try and do for these patients. So if you have a patient that is critically ill and you don't think it's going to tolerate anesthetics like ketamine, or you don't think it's going to tolerate alpha-2 agonists, then doing something like an opioid, a local anesthetic injectable, and a benzodiazepine could be very helpful. So this would be something like methadone, lidocaine, midazolam, or fentanyl, lidocaine, midazolam. These are some combinations that can provide good quality sedation for critically ill pets with minimal effects on the heart rate and the blood pressure. You may or may not require reversal agents for these animals. So remember that drugs like alpha-2s, not only are they sedative, but they also provide analgesia. So if you have an animal that is painful, I wouldn't necessarily take away its opioids or its alpha-2. And also, if you have an animal that's really aggressive, don't just take away its alpha too. Like, let that animal have that. Generally speaking, I personally only reverse animals if there is a problem or I have a concern about their health. If they're doing okay, then I just let them have their drugs and let them recover on their own time. Kind of like I said earlier, one last thing to consider with all of these things is that we've talked about multiple times, sedatives do not guarantee immobility. So if a doctor tells you, I want to sedate it, but it cannot move, or it needs to be more still and you've already sedated it, this is your cue to convert to something like general anesthesia. Because no matter how many sedatives you give, you just can't guarantee that they're going to be motionlessness or like be without motion. But if you give them anesthetics, they certainly will, and you can guarantee that. So wouldn't it be so much safer to just give them an anesthetic and get that done, get them intubated on oxygen, instead of giving more drugs, and it's still not what you want. So think about that and think about the things that you'll need and maybe some stopping points. And in terms of lac repair, you should be good to go.